Hello, everyone. Today I'm going to talk to you about multiple sclerosis. This is Dr. Benjamin Allen, board certified in physical medicine and rehabilitation. Now, what is multiple sclerosis? Multiple sclerosis is an autoimmune disease that affects the central nervous system. When you hear anyone say central nervous system, just think brain and spinal cord. Now, the central nervous system is how information travels throughout our body to transmit information that we need to do our daily functions. Thinking, moving, working, talking, everything we do requires a signal from our brain to get to somewhere we need it to get so that we can accomplish the response or the action that we want. So you can imagine if someone has multiple sclerosis, they can have impairments in any of their functional capacities. Now, multiple sclerosis is a disease that attacks the myelin in our central nervous system. And you can think of myelin as a coating of the neurons that speeds up the transmission of signals between neurons so that information can get to its destination efficiently. And if myelin is damaged, the ability of that information to be transmitted is interrupted. So I call it a insulating speed conductor. Think of myelin as an insulating speed conductor. Or if you would think of pigs in a blanket, or I don't know what you call those things with the hot dog and the cornbread around it. A corn dog. There we go. The myelin is the coating of that hot dog. And in multiple sclerosis, that coating of cornbread is being eaten up by the immune system, and it's attacking it as a threat when it really isn't. Now, the cause of MS is not clear, but there is higher risk linked to certain geographic areas as well as vitamin deficiencies and infections. Like vitamin D deficiency has been linked to multiple sclerosis. Now, common signs and symptoms of multiple sclerosis could be sudden loss of vision, fatigue, impaired bowel and bladder function, imbalance or deficits in mobility with walking, weakness. There are a plethora of signs, but those tend to be the most common. And depression is also very common with multiple sclerosis. Now, flare-ups in multiple sclerosis occur at different times, and there are things that can aggravate symptoms or contribute to a flare-up, like an infection or a very stressful time period in someone's life, or being exposed to a high heat environment, or injury. These things can contribute to aggravating factors of multiple sclerosis. And sometimes you can have lesions in the central nervous system that are old or quiet that can manifest themselves in the presence of an infection or overheating. So be mindful, if you have multiple sclerosis, of symptoms changing based on your environment, because environmental factors have also been linked to multiple sclerosis, like smoking. So it's very important to live your best healthy life, to live a fulfilling and productive life, even if you have multiple sclerosis. Now, what to do about it? There are various treatment methods. There's immunotherapy, there's steroids, which are usually used for flare-ups. There are infusions, like plasmapheresis that is used, and you can consider plasmapheresis like an exchange or a cleaning of the blood to get rid of the antibodies that are attacking your central nervous system and kind of filter it out. Then there is preventative things you can do to keep it from worsening, or the physical manifestations of multiple sclerosis from completely disabling you. So it's very important to have a comprehensive rehabilitation program under the advice and direction of a physical medicine and rehabilitation specialist, because a lot of the times when people have multiple sclerosis, they're not aware of the deficits that it's causing. So, for instance, there could be some slow processing with cognition due to lesions in the brain, but it's hard for individuals with multiple sclerosis to identify the issues when they are early in the multiple sclerosis course. And sometimes it's not obvious to them. So it's important to get evaluated by physical therapy, occupational therapy, and speech therapy to see if there are any deficits that need to be worked on, so that things don't become worse when they could be better. Now, the next thing, it's important that you get a neurologist. A neurologist can help to confirm the diagnosis and get you treatment and monitor you. And it's also important that you continue to care for yourself properly and don't fall into despair, because some people take this diagnosis as an end of life diagnosis, and every prognosis that you're given does not mean that's going to be your story. So just be mindful of how you mentally respond to a diagnosis of multiple sclerosis, and be careful not to take it as an excuse not to pursue your dreams or do the things that you've always wanted to do. I mean, people who haven't been given any type of diagnosis or illness can act like they have their whole lives to do something they've dreamt of doing and never do it. So why not consider the thought that I should number my days and take this opportunity to do as much of the things I wanted to accomplish in life now? And I advise that for anybody, whether you've been diagnosed with something or not, because tomorrow's not promised. That's just life. But anyway, the other thing that I wanted to mention is it's also important to have an ophthalmologist, that's an eye doctor, to evaluate your vision and make sure there are no areas of concern that need to be addressed, because you also don't want to wait for a problem to manifest itself if you could have done something early to prevent vision loss. So optic neuritis is one presenting symptom of multiple sclerosis, and that's just inflammation of the optic nerve, and this can cause blurry vision or temporary vision loss. And it's important to have an ophthalmologist on your team. Now, for caregivers, what they might find hard is the need for the individual with multiple sclerosis to be in a cool environment. Like sometimes I've walked into a patient's room who has multiple sclerosis and it's freezing. So just bundle up and know that that is the climate that they feel comfortable in, because high heat can aggravate multiple sclerosis. And especially if somebody's had a flare up, sometimes you'll find that they want the AC at the highest level to be comfortable. So just be aware of that. And also be aware that multiple sclerosis causes fatigue. So be careful not to be too hard on the individual with multiple sclerosis or think that they're being lazy when they're saying they're tired. This comes with the disease. And it's important to exercise even if you have multiple sclerosis, because exercise is very important for our well-being. But you have to do it in increments that are tolerable. So someone who has multiple sclerosis might want to do a 20-minute workout as opposed to a 45-minute or 1-hour workout, just to preserve their energy reserves to accomplish the things that they need to do in a day. So you might do a 20-minute workout routine and then do another 20 minutes at a different time in the day after you've completed everything that you need to do. Or maybe 20 minutes in a day is what you can take. But don't feel like you have to overexert yourself, because there is fatigue associated with multiple sclerosis. So that's where a comprehensive rehabilitation program will come into play to help give you the exercises and the direction and the framework for you to maintain your fitness and your health without falling into this despair or I can't do anything because I have multiple sclerosis. That is so far from the truth. Now, the next thing I want to talk to you about is making sure you're getting enough vitamin D. Sunlight is important for our health, so you want to get a good dose of sunlight every day if you can. And trying to think if there's anything else I wanted to talk about. I mean, there are a lot of things, but that goes beyond the scope of this talk. I kind of just wanted to touch the surface and help out anybody who's having multiple sclerosis to know some steps to take and what they need to make sure they have so that they can do well despite that. Now, if you're a person who would like to partner with a physician who can help you achieve improved independence, increased mobility, function, and quality of life, I invite you to join me at Freedom Wellness Physiatry by booking an appointment. And I look forward to joining you in your journey to living better. Have a great day. Bye-bye.